Staff of Mary Health of Africa Hospital in Fontem have been sensitized on hygiene and sanitation practices as part of effort to improve water, sanitation and hygiene at the health facility. The training is part of a project to rehabilitate the drinking water supply at Mary Health of Africa Hospital and Our Lady Seat of Wisdom College, Fontem.
We are presently at the Mary Health of Africa Hospital in Fontem, where we educate the entire staff, the community of the hospital on how to manage the water system which is being rehabilitated.
The sensitization brought together hospital staff to learn more about proper hygiene and sanitation practices within the hospital environment, including appropriate practices in their interactions with patients.
We educate staff on how they can do simple maintenance around the compound, around the hospital premises while waiting for large rehabilitation programs. For example, when a pipe is broken, how to do reporting, how to immediately resolve the issue before seeking the aid of the maintenance system or the plumber that is in charge. Also, we teach staff how to properly segregate waste by providing the materials that are needed, like the waste segregation bins, where, because we are in a system like the hospital system, it has a lot of hazardous waste like medical waste. So we teach them how to segregate so that we can properly manage the waste in the system. Most especially, we're also teaching staff how to practice hand washing so that they can pass on this knowledge to the patients, the inpatients, as well as the caregivers, so that we can uphold their well-being.
Steve William Azomo, project manager for the rehabilitation project, explains the objectives of the intervention and the work being carried out.
So the project is implemented by the NGO AFZ Foundation and being funded by the Italian Episcopal Conference. It consists of, first of all, rehabilitate the water catchment at the source for potable water, rehabilitate the tanks, the water tank, that means that to have a potable water, and then also to rehabilitate the system, the water supply system in the hospital and in the college. The whole system was in Galva, and Galva pipes are not healthy. So the project helps rehabilitating the whole supply system in the hospital and in the college. Now that it's done, the next phase, it is the WASH program, training and sensitizing people on the WASH, water, hygiene and sanitation, how to sustain the use of this equipment that was given, try to sustain also in the population the importance of having potable water around. And there are three main partners implementing it: AFZ Foundation, the Focola movement, and the funder that is the Italian Episcopal Conference.
For the hospital management, the training is expected to complement the improvement being made to the water supply system. The director of the hospital explains how the lessons from the sensitization will be implemented within the facility.
This project is going to help not only the workers, it is going to help the patients who pass through the hospital, because the aim of the project is to enable the community that comes to the hospital to drink water that is safe, and also to carry out practices that we prevent further spread of diseases to patients who come to the hospital. We carry out sensitization programs twice every week, on Mondays and Fridays. On Monday, we target the outpatients, women who come for antenatal care, and all the people who are around. And then for Friday, we target hospital market sellers and maintenance workers of the hospital.
Staff who participated in the training also shared how they intend to apply the knowledge gained in their respective departments.
The WASH program, since mostly in ultrasound, we deal with different types of patients. Mostly we send some to the toilet before coming back, so always educate them that immediately after you are from using the toilet, you need to wash your hands before coming back, so that you should not come and lie on the bed and contaminate somebody or the next person climbing on the bed. Despite we have our bed rules that we change per patient, but at least you handling the surfaces, it can contaminate the surface and another person can pick it from it.
What we are seeing that this GAVA is really causing is because it's having a lot of rust inside, and whenever you open it, it will come with red color. That means it's the GAVA that is giving the red color. I mean, it will come as rust. So that's why we have seen that, and then we say that it's better to come with a plastic pipe, and this pipe that they have put now as the PPL pipes, they are very nice because they doesn't rust, they doesn't just break anyhow.
The intervention combines the rehabilitation of the hospital's water supply with sensitization on hygiene and sanitation, with the aim of supporting proper water use and hygiene practices within the facility. Mary Health of Africa Hospital serves patients from across the BLM, making access to reliable water and proper hygiene practices important to the day-to-day functioning of the health facility. As the rehabilitation project progresses, staff are expected to put the knowledge gained from the training into practice as part of efforts to maintain hygiene and sanitation within the hospital.